you've walked into your pharmacy lately and you weren't able to get your COVID shot without a prescription, you can now go back and get it. Maybe. After the licensing board deemed pharmacists able to prescribe the vaccine, individuals will now be able to work with their pharmacists to get them. There's been a lot of confusion about the COVID-19 vaccine, and I also want to talk about the flu vaccine. Luckily, we have with us in studio Lois Collins, reporter from the Deseret News, who wrote an article about this, and I was reading the article almost concurrent, Lois, with my going into my pharmacy and getting the COVID and flu shot. Now, I walked in off the street, hey, can I get the 2 shots? No questions. Of course, they knew me there. Lift up your sleeve, both shots at the same time, walked in, walked out. I don't recall paying anything. I don't recall showing them a prescription card because I was a regular, I guess. You had a little bit different experience.
Yeah, I had a totally different experience. And I want to start this by saying that I'm confused a little bit too, simply because it keeps changing on me. So as I try to report it, the rules keep changing. You and I both belong to a group where there's no question. We're both over 65.
Yep.
So we are in a category for whom the FDA said, yes, you should definitely have a COVID shot. And the flu shot was really not in question. Most people who've gotten the flu shot in the past can get it again. It's not like they changed the categories for the flu shot. They did for the COVID shot. So what happened, I'm going to ramble here for a minute.
No, I want
give
you
a
to.
Brief history. But what happened was people over 65 and people with conditions that make them more apt to have severe COVID are who the COVID shot is recommended for by the FDA licensing. There's a separate committee that's in the CDC called ACIP. It stands for, and I always have to write this down, it's the Advisory Committee on Immunization Practices, which make the recommendation to the CDC director, who then decides what's the official recommendation from our biggest public health agency. They do not have the same recommendations. The ACIP this year, which is it's not a brand new committee, but it's brand new membership. When they met September 18th and 19th, they recommended the COVID shot for people over 65, but they also recommended it for those over 6 months. That has not yet been approved by the CDC director, who is actually he's the acting CDC director. He's a tech investor who is the Deputy Secretary of Health and Human Services. So this is all kind of weird and squishy right now. And Utah was one of the states that does not allow pharmacists to give shots that are not recommended by the CDC, by ACIP, and by the FDA. So there's some confusion there. But after the committee voted specifically not to require a prescription, which was in a tiebreaker vote, the committee chairman broke the tie there. DOPL, which is the Division of Professional Licensing in Utah, sent out a letter to pharmacists saying, okay, we're going to let you do this, to the groups that are recommended. So where it stands right now, bottom line, supposedly you can walk into your pharmacy. If you're 65 and older, they can give you the shot, no problem. If you're younger than that, you can sign a little thing that says that I have one of the things that would make me be more prone towards severe COVID, and you'll be able to get it as well. The very bottom line in this multi-layered confusion is you should call the pharmacy where you want to get it and say, do you have the shots? Are you requiring a prescription or not? But according to DOPL, they do not have to require a prescription now. So, and that could change, because if the CDC director says, no, I reject that, then it's all up in the air again.
So, I don't know if this is a fair question. So my kids, they're all in their 30s or 40s. They have no conditions. They're not 65. If they want a COVID shot,
they can go in and they can sign a thing. The pharmacy does not ask you what the condition is.
No. What if they say, I don't even have a condition? They just say, you know what I mean? Like, I
think that's going to depend then on the pharmacy.
Right. But I mean,
I
guess what I'm thinking is, can they just pay for it? Like they're.
Oh, that's expensive, but yeah, they probably
is?
could.
Okay.
They could get it for somewhere between $108 and I think it's $60, depending on different things. You can go to your doctor. You can always go to your family doctor and say, hey, I really would like to get a COVID shot, and the doctor can look at you and say, hey, I'm a medical provider, and I can say that you should get a COVID shot.
Right.
And they can give you a shot. County Health has doctors and medical professionals who consult with you and can decide. Not everybody has equal number of shots available, so your family doctor may not actually have a shot available right now because they take a risk financially when they decide how much stock they want to carry. And I know that the health department clinics just barely got their supply. So the bottom line really is, if you want a COVID shot, you can probably get it, but you need to call and make sure that the person that you want to get it from has it on hand. If your kids don't have any condition, they can either sign the testament that they think they're at risk of severe COVID. And honestly, we don't any of us know who.
Absolutely.
There
Right.
are lots of people who are perfectly healthy. I had a sister-in-law who was perfectly healthy and who died of COVID. She would not have been on the list.
Yeah.
She was younger. She was whatever. So there are ways to get the shot if you want the shot, but it kind of depends on who you choose to get it from and what they're going to make you go through to get it. Right now, it should be relatively easy to get it at a pharmacy.
What are the latest guidelines, if you know, about boosters? Like how often, or does it depend on whether there's some new variant out there? It just seems like every once in a while they say it's time to get your COVID shot, and I'm just one of those people that sees the sign up in front of the pharmacy that says
Yeah, I'm one of those people.
free COVID and flu shots. Okay, that must
I'm
be
one of
time
those
to do
people
it.
too. And when they say free, they're assuming that you have insurance.
Insurance, right.
So if you don't have insurance that covers it, then maybe not. And insurance policies may be changing as the year shifts. It's really hard to say. There's so many moving pieces right now because the vaccines have been called into question in a way that they never were. They were considered, warp speed, which developed these COVID vaccines fast in the first Trump administration, was considered a real miracle that they pulled it off. And now the same administration, same president, different group of leaders, has called it into question. So it's a moving target. But as far as how often you get the booster shots, it is, to my knowledge, it is still considered you should be boosted every year because it changes just like the flu changes.
Right.
There are different variants all the time, so they try to project what the variant will be, and then they make the shots to go with that. And by the way, there's another twist in this year. You can, if you fit one of the categories, you could actually get flu mist and take it home and do it yourself.
Oh, never thought about that.
So go figure.
Yeah, I still do the flu shot every year. I don't know why. I just do.
I do it every year because I once had the flu, and it was the most awful experience. I thought I'd had a touch of flu, and I am here to tell you, Greg, that there is no touch of flu. It is a semi-truck running you down of flu.
I think I had that about 20 years ago, and I told myself I'd never do it again. I thought I was going to die.
Yeah, once you've had it, and people die of flu.
Yeah.
30,000 people a year in the United States die of flu, somewhere around 36,000. So if you've ever had the flu, I'm betting that you're more than willing to get the annual booster.
Oh, yeah, I don't care. And I work as a first responder up on the ski patrol up at Powder Mountain, so I'm in contact with people and body substances, and, I do EMT type work. Even when I'm not patrolling, I'll respond to things. And so to me, because I'm exposed to people in a situation that I'm not when I'm hosting here at KSL, I always get the shots every chance I can. And when it's time for a booster, I get it. And so far, knock on wood, I've been lucky.
Yeah, and I'm still mostly just a really good speller, so that does not increase my risk much. But I live with my husband, and he had a transplant, so he's immune compromised. So I always get the vaccines that are needed just to protect him. And that's what herd immunity is supposed to do, too. If enough people get the vaccine, then those who can't get the vaccine have some protection that they wouldn't otherwise have.
Right. Well, thanks for the information, Lois. And I know we pivoted quite a bit, but I rely on you for things like this. And thanks for coming in studio, because as you can see, I'm all by myself today. So
yeah, it's kind of lonely.
Nice to have somebody in here.
It's lonely at the top.
Yeah,
It's lonely.
Thank you. Coming up on Inside Sources, beloved winter attraction in Midway, the Ice Castles, will not be returning to Utah this year. We'll be talking to Ice Castles founder Brent Christensen. There's an Ice Castles founder, Lois, about the freeze on operations. Oh my, who wrote this? And what's going on with Utah's warm temperatures. We'll be back.